craving satisfied.
Anything can happen in the shift.
Patient's happy, I'm happy. Patient's happy. It's normal, right, to feel this way at this time of the day, and no task seems too big or small. We're there for our patients, and yeah, that is the essence of nursing, right? I'm excited to show you my journey. Hello! So, today we're gonna do vlogging. I'm quite excited for this. I'm going to be vlogging my day as a registered nurse working in the NHS. At present, I am still working in intensive care unit. For those of you who don't know, intensive care unit is essentially where the sickest patients in the hospital are being cared for. At present, we are living during COVID-19 times, so the intensive care unit has a lot of COVID-19 patients who need to be on ventilator treatment, so they need to be intubated. Also got some patients who are post-surgery as well, so we've got a mixture. But at the moment, we've got, patients who really are very sick. So yeah, today is gonna hopefully be a good day, a productive day. It's about 5:40 in the morning, and this is when I pretty much start my day. I've got a long day shift today, so my shift starts at 7:30. And handover goes well, if everything goes well, then hopefully finish for about 8 o'clock. So it's about 12 hours, give or take. Yeah, let's see what happens today, and I'm excited to show you my journey. So just a few things that I take with me in the morning, and like when I pack my bag. In here is just some like tablets that I take, like my multivitamins and paracetamol and stuff. I just have that in there. I have wipes so that if I feel like, if I just need to wipe down a surface or before I enter my car, things like that. So I always carry this. These are pretty good as well, quite small, and it's Dettol. Dettol's always a good idea. This isn't a necessity. I really like this actually. My friend, I got this, she had this in her car, and I must say the smell is so good and I really like it. So I just keep this with me if I feel like, I don't know, I stink a bit, I guess. That's the purpose of this, right? But yeah, so I carry that with me as well in my bag. This is the surgical mask that we use before we enter into the hospital, so I carry that with me. Everyone within the hospital, regardless of what profession you are, has to wear a surgical mask like this in the corridors, if you're in a room, if you're sitting in the staff room. I guess exceptions when you're eating, of course, you can't really eat through your mask, but so I carry that with me as well. I've got 2 in there, and then this is just my my little bag, how to say it, where I keep essentials in there. I've got some cream in there. I've also got some wipes for my face during or after the shift. If I definitely do, I just wipe my face because then I feel better. There's some other stuff in there as well, like rubber bands, hair bands, bobby pins, because girl's got to keep her hair in check. So yeah, that's just some of the things that I pack in my bag. So I've just arrived at work now. It's about, what's the time? I should check the time. 10 past 7, so I'm going to be heading in soon. They've made quite a lot of changes to the hospital at the moment, so when you go in you have to wear a surgical mask I've got mine here with me, and then I'll go into the unit. I'll pick up a fresh set of scrubs because in intensive care unit we have to wear the disposable scrubs. You don't really want to be going home with the uniform that you've worked in, so we still are using scrubs there. So I'll go and do that. And yeah, at the moment in the hospitals we still are having COVID patients here, but it's a lot more settled, touch wood. That's a good thing. I hope it stays that way and we continue to progress, because, you know, flashback to 2 months ago when I was first redeployed, or even before I was redeployed and I was still working on the surgical wards, it was really intense. It was really difficult. We didn't really know what to expect. We had these really sick patients coming in and we didn't have much understanding of the virus as well. And that also means that when it comes to our nursing care, like, we want to give the best care to our patients, but we also need to understand exactly what our patients, you know, from a physiological point of view, from an anatomy point of view, health point of view, everything, what they're dealing with, what they're experiencing. But, you know, we didn't have that information at the time. So now, you know, two months later, a bit more than 2 months, it's, you know, there's more of a routine, there's more organization, so that's a good thing. We don't know what can happen. I'm making this video now, don't know, but right now, let's stay positive. I'm going to keep saying that. I like to think I'm quite a positive person, or like if there's a bad situation, always try and look at the good in that, and I think that's really important. And especially first thing in the morning, I think it's important to have that kind of vibe and energy. So yeah, so I'll check in with you guys a little later on, hopefully on my morning break, and I'll speak to you then. So it is the first break of the day. The time right now is 9:59. So just pretty much 10 o'clock, which is the standard time we would go for our morning break. So my morning so far, the first thing that I did when I came into the hospital, grabbing my fresh set of scrubs, so we change into that in the changing rooms, and then we go and receive the first handover for the day. Now then, the first handover of the day is when the night nurse essentially speaks about every single patient that has come to the unit or is currently on the unit. So we could have had new admissions overnight, we could have had patients transferred from the wards, or even patients who've been discharged but they're taken off from the system. So the handover is really important, and every nurse and care assistant will hear this handover. So another thing that we do when we receive this handover is we'll also have to put on our PPE equipment. Now, the PPE equipment is of course a really important thing when we do our job as ITU nurses, as care assistants as well, and of course as doctors who are going in and out of the unit. The PPE, of course, stands for personal protective equipment. There's been a lot of discussions about this in the news and is still very topical, but we are at a point, you know, we're in June now, we're at a point where, you know, there's been a lot more organisation and structure.
Okay, so let me explain to you all the kinds of PPE nurses wear before we enter into the unit. We first start off by wearing a surgical hairnet, and this should be covering all of our hair and reaching over our ears as well. We then wear a surgical gown that has long sleeves, and the principle should be that it reaches up to our knees and protects the scrubs that we wear underneath. We then wear our first set of gloves, which goes underneath our gown. We then have a second set of sterile gloves, which is tightly fitted on top of our gown. And finally, we have a last set, and this final set of gloves is what we will regularly change when carrying out our bedside care. So in total, 3 sets of gloves. We then wear our face masks that all the nurses have been fit tested for. The principle is to create a really tight seal so no air escapes and no air is also coming in. We also wear face goggles or face shield to protect our eyes and offer extra protection. And we also do an encouraging thumbs up and pray we do not faint with all these layers on.
So the first thing I do when I come off the unit is drink water. You get so dehydrated with the masks and the PPE that, you know, if you're not drinking water, it can have really bad complications for you. It's never good to be dehydrated. In fact, I think for my skin, it's
you know, it's dehydrated, I can tell right now, so I will drink all of this. My skin has suffered so much because of, I guess, stress, but also because of the work that we're doing and being in an environment where it's really tough to wear all of the PPE equipment, no aircon, and work. You know, my skin has broken out, my skin has felt dehydrated, very dehydrated. I might even share some pictures of what I've experienced wearing this PPE equipment. And yeah, it is what it is. We've got on with it. I've got used to it, but it's been tough. Yeah. So just to explain a little bit about intensive care unit, at present we have a hot side and a cold side. So the hot side is where we would have the patients who've got COVID-19 or are suspected with COVID-19. They would go to that side of the unit. And then we have a cold side, and in the cold side we would have patients who are COVID negative. So they are not getting any exposure whatsoever to COVID patients, and they are still receiving critical care treatment and nursing care whilst in hospital. Yeah, my morning has been quite, it's the norm. This is the norm, and I'm gonna go back onto the unit now. I'm gonna grab something to eat. So, second break now. The time is 2:15. It's this is what wearing the mask after a couple of hours looks like. I'm ready to eat. I'm ready to chill for a bit. It's been really busy as soon as I walked back into the unit, which I'll update after I eat something. I think I need that. So yeah, all good so far. Patient's safe, staff's okay, and yeah, ready to just rest. I'm just warming up my food now. I still have to wear the mask because I'm in this kitchen, which is a communal area. There's no one here at the moment, but I have to just respect the hospital policy. So yeah, warming up my food, and only when I'm sitting down and eating and I'm not facing anyone can I take it off and, you know, eat properly, I guess. Happy nurse. So the time right now is 3:10. You can't even see it, you just see like a cat on my screen. But it's 3:10 right now, so I'm about to go back onto the unit. So in about 5 minutes time, because it's the end of my break. Had a good rest. I'm ready to go back to my patient. So just a bit of update of what my afternoon was like before I went on break. So the doctors had reviewed my patient and they set the plan, and we, in fact, you know, when the doctors came round to review, we found that the blood results had come back and she had quite a low HB. Gave 12 o'clock medications. Then the pharmacist came, and that is when I liaised with the pharmacist to order in any medications that the doctors may have prescribed, or any medications that the patient may have run out of. Also, the physiotherapist came to review my patient. She's able to mobilize, but she's got very edematous legs, and she's also got something called restless leg syndrome. I believe that's the correct term. I'm gonna double check that. This is something my patient has had for a couple of years, so she does get tired quite quickly. She finds that her legs are heavy. So, you know, we have been walking with her, ensuring that she is mobilizing. Of course, it's really good for her as well. It's good for her pressure areas. We don't want her sitting for too long, and it's part of recovery, getting your patient up. Now, as a nurse, you liaise with so many different healthcare professionals, and you kind of have to, of course, you have to be on top of it, because that can then cause a delay in your care that you're providing for the patient. And also, like I have said before, these are essentially the glue between all healthcare professionals. I can confidently say that, because we are with the patients literally from the beginning of the shift till the end, till the evening. So we have to really know our patient, from their medications to their medical care to the physiotherapy care, and of course nursing care is part of it, but everything then becomes holistic care, and that's part of being a nurse. You need to know all aspects. So yeah, I'm ready to finish off the last third of the shift. Hopefully, if it's not too busy, I will get an evening break, and that'll be quite good because it gives me a little bit of a break from the masks as well. That's actually a really big reason, and also just needing to just take a bit of taking the time to just reset myself. So let's see what happens. Okay, so it's evening break now. It's my last break for the day. Yeah, I think the tiredness is hitting, the dehydration really is there, hair's getting messier, face is looking drier, standard sort of thing. Yeah, so I don't know why I feel so bad, but I'm just tired. I get really tired around this time. Yeah, let me start again. What's really important that I want to make as well is that at this time is, you know, the energy starts to drop. You feeling more tired, hungry, all those emotions that I guess you would normally feel. And what helps me at this time is really using my break times just to chill. So I will go to like the staff room and just like sit down. I might even sleep. Gotten into this acceptance really that I need to do what I feel is right. So if that means just like napping for 15 minutes, a power nap, I will do that. It's important when we do our care that we look after ourselves, and you have to use the breaks within your shift to look after yourself, because the rest of the time you are looking after your patient, rightfully so, and you know, liaising with your team to go outside, get some fresh air, do it. There's one doctor who actually goes for a run in her break. I mean, I personally wouldn't do that. I mean, of course I wouldn't do that, but good on her. If that's what makes you, give you that push, I support it. Long day shifts are interesting. Yeah. So I'm going to listen to my own advice now, right? You got to practice what you preach. I'm gonna go upstairs, I'm gonna drink some water, a lot of water, maybe have a snack and just sit with the other nurses, catch up on life, watch some TV, maybe rest, whatever it is, whatever I feel, I'll do that. And yeah, last quarter of the shift remaining once my break's over, and then yeah, that'll be me done for the day, but yeah, still to go. And that's it, all done. The time is 8:12 in the evening and the long day shift is officially complete, so I'm gonna get ready to go home. But before I do, I like to just take my time, I guess. Like, you would normally like rush and get out, but I'm just like, it's really important that once you finish your shift that you also start to de-stress, and that's really important to me. So I'm going to take my time, change properly, also wipe my face because I feel so sweaty and my face hurts a bit from wearing the mask. Drink some water and then I'll leave as soon as once I've done all of that. But yeah, no, grateful for the shift. Probably when I get to the car I can give a bit more of an update.
It's home time. I'm gonna go and rest now. Let's see. Okay, we did it. We're in the car now. God, my face is so red. Oh, it feels really sore as well. Really grateful. We did it. If we compare how I was at the start of the day to now, this is what happens. You work long day shifts, you're in an environment which is, you know, stressful. There are, you know, the PPE really does tire me out. That's just the truth of it. And I feel dehydrated. I feel, I guess, more tired than what I would normally. It's now 8:26 and this is just how nursing life is. And there's a spider on my car screen. Ew. Thinking about how during this time of COVID-19 there have been so many changes to the hospital, but what's kept us going as a hospital and as a unit and as nurses is just being dedicated to our work. It's definitely shown me that I can deal with an extreme situation like a pandemic, and I'd like to think still deliver care that I can walk away from and be really proud of, or at least take away and learn from it. It's a bit strange that an extreme situation like a pandemic had to take place for me to realize that. So be it. Maybe that is what it took, that are capable of achieving great things, and as you know, nurses, we are capable of adapting to very strange situations, but as long as we have the passion and the care that we do for our job, then I think anything is possible. So yeah, it's been a good shift. It's been a tiring shift, but patient is safe, the team is happy, and I can go home now and chill and start to just relax a bit because it's been a long day and I'm really hungry. So yeah, that's it from me. I really hope that anyone who's watching this and taking the time to watch this, and if you've watched this till the end, then I hope you've learned something. I hope that it's given you really good insight into what nursing life is, and especially a nurse who works in an intensive care unit and a high risk area where we have COVID patients or have had exposure to COVID patients, and this is what we do. And I just hope I've been able to represent that in a positive way and in the best way possible.